We are creeping closer and closer to spring, which means allergy season is also just around the corner. Dr. Douglas Anderson with Ogden Clinic has a few at-home solutions that will limit the sneezing and suffering. I feel like we're already anticipating, my husband and I, every little symptom, we're like, it's probably allergies. It's probably allergies. Are we seeing the allergies come on a little sooner this year?
Yeah, I think as the weather is warmer this year, that we're going to see those trees starting to blossom a little sooner, and as that happens, we'll have earlier symptoms that'll be coming about. So
you mentioned the trees. What are the biggest culprits?
You know, around this part, aspen, birch tree, maple, those are some of the common ones. Cottonwood's a biggie, especially up in Ogden. So those are some of the more common. But there's several others. You know, mountain cedar is another one that, and juniper or others that can cause allergies.
Here's the big question I think a lot of people wonder. I know we do at my house. How can you tell if you are experiencing allergies or if it's just a cold?
Cool. That's a great question. You know, a lot of the symptoms are very similar for both, but one way to tell a difference is usually if you have itchy eyes, that's more a sign of allergies versus a cold. Another distinguishing symptom is fever. Usually if it's a fever, that's more a sign of a cold than allergies. And then just timing. You know, usually if you've been out running and it's windy outside and you come in, you're sneezing, you know, that's going to be an allergy.
Right.
Whereas later in the day you may be feeling better. Where a cold is going to, a viral thing is going to take 3 to 14 days to go away. So
you can do the math and kind of assess what you were doing up before those symptoms kind of started to manifest themselves. Talk to me a little bit about what we can do as homeowners, as parents, as families to reduce the allergens in our own home.
That's a great question. You know, when I was a boy, I remember my mom used to have us take the mattresses outside and would get a broom and just smack the mattress, and dust would be coming out. And so now we're a lot smarter than we used to be. You know, we say that you ought to keep the mattresses off the floor, have a wood or metal frame. There are covers that you can put around the mattresses that can be sealed to keep the dust mites out. They say for every gram of dust in a mattress, there's about 100 dust mites. So you want to try to keep those.
As we all start itching,
I know,
right?
Exactly. You start itching. And another thing you can do is a lot of people have lots of stuffed animals on their beds, and those can be a reservoir for dust mites. So you want to limit the number of stuffed animals on the bed. And if you do have stuffed animals, it's probably a good idea to wash them regularly. And if you do wash them, make sure you put them in a dryer for at least 20 minutes to sort of kill the dust mites.
To kind of shake it out, and that heat will also help.
That heat will kill it. And the same thing with the bedding, as far as sheets, that kind of stuff. You want to wash them regularly, and then put them in a dryer. So hot water, and then in a dryer after to kill the dust mites.
Can we talk frequency when you talk about washing the bedding? And I know vacuuming the house is another one. How often should we really be doing those chores?
Yeah, that's a great question. So as far as vacuuming, you want to try to do it about twice a week if you can.
Okay.
And the other thing is, when you vacuum, you may actually stir up more dust in the air. And so it's important to have a vacuum, and it doesn't have to be way expensive, but sort of a HEPA filter attachment that sort of filters the dust as it comes through the vacuum. So that's a good thing to keep in mind. And then the other thing is, I think, same thing, mopping the floors. If you have floors, just to get the dust off the floor. Because even dust on the floor will have about, per gram of dust, about 10 dust mites. So you want to mop the floors. And then also sheets at least once a week. Again, hot water in a warm dryer.
There are certainly over-the-counter medications that can help alleviate the symptoms. When do you know, though, that you should maybe come see a doctor? What's the line there when the allergies are really kind of taking too much of a toll?
That's a great question. I would say if you're on medications and it's all the time and it's still not seem to control your symptoms, and it's affecting your quality of life. In other words, some people may not be able to focus very well at school because they're stuffy, they have a runny nose, they're sniffling all the time, or they're missing lots of school, or they're starting to have some diseases that are because of their symptoms, such as you could be getting ear infections more often, or maybe your asthma is flaring up, and so you're not able to control those diseases, so you ought to go see a doctor. And
there's some great testing you can do to really narrow in on the problem, right?
Yeah, there's lots of different testings you can do. You know, first of all, a thorough history of what's in their environment, their around, how you know, is it seasonal as far as when they get their allergies. And then I think other types of testing that can be used are blood testing, and you can look for antibodies that are specific against the antigens that cause allergies. That's one method. Another method is skin testing, and there's different kinds. There's skin pricking, and then there's intradermal testing.
Okay, well, great options to consider as we approach this allergy season. Dr. Anderson, thank you so much.
Oh, you bet. Thank you.
If you are already feeling it or you anticipate those spring allergies and want some extra help, be sure to visit ogdenclinic.com. You can go there for more details and to set up an appointment. So ogdenclinic.com. We'll be right back.